start sharing our screen so you'll be able to see the slides here on the screen. And okay. Thank you, Vandana. And now,
Yes.
from beginning. Vandana, will you send it to WhatsApp? Yes. To WhatsApp.
Ma'am, I don't have your WhatsApp number. Can you share in the chat?
I see. WhatsApp number. Okay. So it's okay. I'll just copy it from the chat.
Yeah, ma'am.
Thank you. Well, so 2 more people are joining us. Okay. And we can start with the first slide here from beginning. So today we are going to speak about presenting complaints, about how patients present complaints. And so the name of the book, the title is given here. This is the Oxford English for Careers series and Medicine 1. And this is on the next slide, you can see, so the cover of the book, Medicine 1. We'll be working with this book. Well, and so if we start speaking about visiting hospital, the question is, when people go to the hospital with their health problems, what do they start with? What do they do first in the hospital? Who can answer this question?
When they go to the reception.
Will you repeat, please?
And they go to the reception to inquiry like what are where is the proper like hospitality center or the room where it is. In India there are local government hospitals, so we go to the inquiry center first of all to inquire like where is the proper guide, like who will guide us to the, yeah, who will guide us to the proper department.
Okay. And during the pandemic time, what do people start doing first when they enter any kind of building?
First, they
Well,
have
they check.
to sanitize themselves.
Yes, use
Their thermal
sanitizer.
checkup will be done, and then the security allows them to go inside directly with keeping in mind the social distancing to the
Yeah.
reception counter.
6 feet.
And, okay. And people wear masks, right?
Yes.
Okay. Yes. So if we move to the next slide here, we can see the information about keeping patient records. So a doctor or a receptionist takes the patient's personal details, as Aman has already said, and then when the patient goes to the doctor keeps patient records. And patient records can be kept in different ways. They can be kept on computer or on paper. Which of these two systems do you think is better?
I think
the
computer is
system
better.
is better. The traditional method was considered as the paper one, but it gets misplaced or maybe damaged. So the records can be mashed up. So rather than that, the computer is better. So we can access the file from wherever we want to, whenever we want to. It's better.
It's very easy to share the information.
Storage and access is easy.
I see. Okay. And is there any are there any advantages of keeping records on paper?
Yes, ma'am.
What are they?
When we can store a large amount of data in a very little place.
Mhm. Okay, I see. Okay, but nowadays everyone is moving to saving information on computer, of course.
And one of the advantage for paper is that when, for example, if the electricity or maybe the situation is not proper, when the availability of the electricity or maybe the internet connections are not there, the papers is better
Right.
for reference.
Ma'am,
Exactly.
also with computer there is data redundancy, and also things can be copied. I mean, they can be misplaced, and they can be created. They can be misplaced and created on their own. So
Yes, it's not.
paperwork is considered the best, and it is given the most foremost priority because it is used.
Privacy can be given by paper rather than computer.
Yes.
The
So
patient's privacy is better.
That
it's
is why
a-
they're stored in both the methods. They have both the methods in mostly in all the hospitals.
Yeah.
Yes, safety is very important. Okay.
Yes, ma'am.
Okay, so let's move on. And so today we're going to speak about presenting complaints. So PC, this is the abbreviation. And so here we can see that this term presenting complaint is used mostly in Europe and in Canada. In America, they use another term, chief complaint. And here we can see the definition of this term. So presenting complaint or chief complaint is the initial concern which brings a patient to a doctor, or in other words, the reason for which a patient approaches the doctor. So, and when the patient comes to the doctor, so the doctors use the so-called Socrates model. So doctors use Socrates in the history of the presenting complaint to help them remember the main questions that they need to ask about pain. So, and you see that each letter in this model Socrates word stands for a separate piece of information. For example, S stands for sight. So the doctor should figure out the site of the pain. O stands for onset, character. C stands for character. Then there is radiation, associations. T stands for timing. E stands for exacerbating and alleviating factors. And the final S stands for severity. So is everything clear in this list of words?
Yes, ma'am.
Okay, good. So the question is, what are the questions that a doctor asks about pain? So if we start with sight, what is the question?
From where is the pain?
Location,
Where is it pain?
prominent location.
Okay, what about onset?
When did it start?
Character.
You figure out.
Character.
How it is? How do you feel the pain? Is it pinching?
What
or
kind of pain or what
something?
kind of
Yeah.
problem?
Yes, okay. What about radiation?
From where to where this pain is traveling? I mean, if it is developing at this place where till where you can feel the pain, radiation.
Associations.
Anything
Other
else with the
symptoms
pain?
And it will
along
get
with
associated with that
the
time.
other symptoms.
What about timing?
How
The
long
duration
Whether
of
the pain,
particular timing or
how long the
duration,
pain
yeah.
was there.
Okay. Exacerbating and alleviating factors.
What
ma'am,
causes the pain
any
to
condition which
increase
can
or decrease? Yeah.
elevate the pain, any
Mhm.
condition which elevate the pain or factor.
Mhm. So it means they make it easier, yes?
Yes,
And severity.
How
how
severe is your
How
pain?
severe is the
Is it
pain?
bearable or not?
it is
how
bearable or
serious the
not.
problem is.
I see.
Yeah.
Okay, good. Now if we move to the next slide, we can see these very questions. We were right about all of them. So about where, then when did it start? And you see that when we speak about onset, we can the doctor can use some adjectives that can help the patient to describe the duration of pain. Yes, constant, intermittent, gradual, or sudden. Yes, the same is about character. If the doctor asks what is the pain like, he can use such kind of adjectives, for example, as sharp, burning, light. So the patient can describe the character of pain. About radiation, does it move anywhere? So, or radiate anywhere? Associations. Associations can be like sweating or vomiting. These are the associations. The timing is clear. Exacerbating and elevating factors, does anything make it better or worse? So, and severity is, there is a good idea to consider pain using the 1 to 10 scale. So the doctor can just suggest the patient to describe the pain using this scale. Okay, and now we are going to listen to the conversation of Dr. Martin and Mr. Wood. And before we start listening to them, let us focus on this slide here. We can see several abbreviations that can may be used in their conversation, and they are used when doctor talks to a patient. So the first, what do these words stand for? Who can explain in number 1?
Number of pulse per minute.
Yes.
Pulse rate.
Pulse rate, 100 per minute. What about number 2, BP?
Blood pressure.
Blood pressure.
Blood pressure
Exactly.
is 100.
And mm stands for what?
Millimeter.
Yes, millimeters of mercury. Okay.
Mercury.
Mercury.
Yes. Number 3, GVP, not elevated. So this is the same as BP. I mean, the letter P stands for the same word, which means pressure. And what are the other pressures that you know? This is jugular venous pressure. Yes, and as you see, not elevated. Number 4, CVS NAD. As you see, NAD is given twice here on this list. Number 9 is also NAD. NAD, this is the abbreviation for the phrase no abnormality detected. No abnormality detected. And
cardiovascular system.
Exactly, you are right. Cardiovascular system, no abnormality detected.
Cardiovascular system, yes.
Okay, OE stands here for on examination. On examination. Number 6, widespread early inspiratory fine crepitations. I think it's clear, but maybe we need to focus on crepitations. What does it mean, crepitations? Any ideas? Crepitations, crepitation is a sound in lungs, for example. This is crepitation. So, audible.
We can hear.
Exactly.
She is able to hear.
Yes. Abdomen normal. This is part of the body. Yes.
Of the body.
Yes.
I think it's clear. And the last one.
Central nervous
system.
Central nervous system.
Which system?
Ma'am, central nervous system.
Central nervous
Central
system.
nervous.
Nervous. Exactly. You're right. Okay. Well, let's move on and compare what we've said with what is given here. This is, we were right. And crepitation, there is a definition for crepitation here, as you see, peculiar cracking, crinky or grating sound around the lungs. Mhm. So the rest you know. Well, now it's time to start listening. And we are going to listen to part of a conversation between Dr. Martin and a doctor in A&D and Mr. Wood. So A&D means accident and emergency. And as you listen, please make your own notes about Mr. Wood's presenting complaint, okay? So I think to start making notes, you need some paper or something. Well, I'll start the recording and you'll tell me, please, if you hear or not, because there are sometimes some technical problems. So let's get started.
Listening 3. Good morning, Mr. Wood. I'm Dr. Martin, and when did...
Do you hear?
Yes, ma'am.
Great. So
Yes, ma'am.
Yes,
we'll start with the beginning now.
Listening 3. Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden. And the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
Okay. I'd like to ask you some questions.
Well, this is the conversation. So what do you understand from the conversation? What has happened to Mr. Wood? Who can tell us in short?
It's same as we saw in the first slide.
So
So
It might-
how we should first make the patient feel comfortable with us by greeting them by introducing them to by introducing us to themselves as the doctor, and then knowing all about their problem and the duration of the problem and everything like we saw in the previous slide.
And what is Mr. Wood's problem? How does he describe his problem?
It might be angina pectoris or some heart condition.
Because of his occupation, he said he was a bus driver and he has to rigid. His hours are rigid, so it may cause it may be caused because of that.
And
Well,
how
he
does
had the symptoms almost 2 weeks ago. His first symptom came approximately a month ago, which was the left shoulder pain. Then the 2 weeks ago, he had the pain along with the left shoulder pain, and right now he is suffering from angina pectoris. This is the conclusion.
he doesn't
She
say
also has the shortness of breath. ma'am.
Shortness
Yes.
of breathing. He has the chest pain in exactly.
First, he tried
He
to take the
isn't able to properly.
first he tried to take the home remedies or the first aid, which he thought may be
He
effective,
thought
but
maybe the
then
arthritis.
when it
that
wasn't effective, then he visited the doctor.
he consider arthritis as an option, which can also happen if he was suffering only from the left shoulder pain, but the chest pain was continuous, constant.
Okay. So does anyone else want to add something? Okay. So, and how does he describe his pain?
He gave the adjective constant.
Yes, constant. And he says that it looks like someone is squeezing my chest, right?
Squeezing the
Yes,
Tightness.
squeezing.
There is a tightness in my
tightness
chest.
and squeezing.
Tightness. Okay, great. Good. So, and
Listening 3.
there are some more questions here. You already said, answered the first question. What does Mr. Wood do? He
Is a bus driver.
bus driver.
Bus driver.
Okay. And the question is, what does Dr. Martin follow Socrates' model?
Yes.
Yes.
He asks all these necessary
Yes.
questions.
Yes.
And you have already answered this question about the diagnosis for the shoulder pain. I mean, what is the correct diagnosis for the shoulder pain? You've mentioned angina pectoris, right? So, but what are the other possible diagnoses can be?
Since he's a bus driver, he may be having continuous usage of the left shoulder, which can also affect it. Arthritis is also an option.
Okay, what else?
Maybe spondylitis
Yes. No.
because he
The nerve.
continuously in a single position.
Yes. The nerve can get
There
affected.
is no more physical activity.
Okay, and the last one, what is the immediate treatment for this disease? If we speak about, for example, angina pectoris that you've already mentioned.
The doctor already prescribed him the painkillers immediately after
Yes.
he complained about his pain.
So this is the painkillers that to make the patient feel better, and what are the other possible treatments?
First is the painkiller, and second one, the treatment for angina pectoris is let him rest until the pain disappears.
I see.
The main treatment.
What about aspirin? Can the doctor use aspirin? Aspirin?
If the pain is worse, then only he can use. Like in this case, the Mr. Wood is already having a lot of pain, so
see.
he can give.
Okay, yes. Well, and let's move on. And so here, while we were listening to the doctor and his patient, so we can say that they use the present tenses. The patient used the present tenses to describe his pain, and the doctor asks questions in using the present tenses structures. So let us focus on the present tenses. They are given here. So, and the question is, what is the difference in the use of the present simple tense, present continuous, present perfect, and present perfect continuous? Who can tell us the difference in the use of these tenses? Silence.
If we talk about present,
And the difference,
Ritik, you go on.
Yes, present. If
And
we
the
talk about-
difference is in helping the form.
sorry, I didn't get it.
Ma'am, the difference is between the helping verb and main verb. In present, simple present, do, does, present continuous is are, and
Yes.
present perfect has, have, and present perfect continuous has been, have.
Yes. Okay.
And
You are
main
speaking
verb,
about the form of these tenses. What about the meaning? So when do we use present simple, present continuous? What's the difference in the use of these forms?
Present simple can be used as a simple question that was asked by the doctor to Mr. Wood. That is, are you in some pain right now? That is, I think so, present simple. Then when we talk about present continuous, when Mr. Wood replied to that he has a constant continuous pain in his chest, that can be used for present continuous. And present perfect, like at that moment when doctor asks Mr. Wood that he has any shortness of breath in the present, that perfect moment, I think so. And the last one would be that he has already shortness of breath, as Mr. Wood said. He is already observing.
Okay. So of course we know this, but this is just for us to focus on this information and to refresh this information. So here is the slide which shows the use of the present simple tense, which is used to talk about something that is true at the moment of speaking. This is general truth. As the person says, I've got chest pains. So, and I've got this is present simple because this is about what happens now. And I feel better. This is another example. The next case when we use the present simple tense is something that is happening on a regular basis around now. A regular basis, this is the key phrase. Usually, always, sometimes. So, and the example says, I get these headaches in the morning. It means every morning, regular. So when we describe regular action, so we should use the present simple tense. And the present simple tense is also used to talk about a process. The examples illustrate this. Like when I lean forward, the pain goes away. So usually, yes, like, and the pain starts in my chest and moves up to my shoulder. This is another example. Well, and as for the use of the present continuous, as you've said, this is M is R plus ing form of a verb. And this tense, the present continuous, is used to talk about something that is happening at the moment of speaking. The key phrase is here, at the moment, or now. So when we speak, we are speaking and something is happening. And the examples, his blood pressure is rising. It is rising now, or I'm having difficulty breathing now, exactly at this moment. And then the present continuous is used to talk about something that is happening around now, not necessarily at the moment of speaking. For example, are you taking any medication? It means not at this very moment, but this week, for example, you are taking medication. And another example, I'm having chest pains. Also not maybe now, but this week or a couple of days, I'm having chest pains, the patient says. And one more case where we can use the present continuous tense is when we talk about something that has been arranged for a date in the near future. It means arrangement in the future. And the example, I'm seeing a psychotherapist next Wednesday. It means the action is planned and it will happen in future, and we can use the present continuous. I am seeing. Well, and on the next slide, you can see some information about the use of the verb to have in the present continuous tense. So the use of have in the present continuous to refer to a moment of speaking is more limited than in the present simple. It means that, for example, we can't use the verb to have in the meaning of I possess something in the present continuous tense. If, for example, I'm holding a pencil in my hand, and so I can't say I'm having a pencil now at the moment. If I possess, I should say I have a pencil, right? But there are some phrases with the verb to have where we can use the present continuous, but they mean something different. In such phrases as have difficulty doing something, have something to eat, or have a shower. It means we can say, he can't answer the phone because he's having a shower. So have is having is we can use it in continuous form. Let us look at, there are two phrases here. Moment of speaking, I've got a pain in my chest. So, and around now, I'm having pains in my chest this week, for example. Well, so our session is coming to the end, and it makes sense to take a break now. The break will last for 10 minutes, and in 10 minutes, we